Examination of lower limbs is a common scenario for the pediatric short case at the final MBBS examination. Examination of lower limbs encompasses a variety of clinical cases ranging from neurological examination to arthritis, deformities like rickets, and conditions like henoxian line purpura with or without arthritis. Therefore, the candidate has to approach the patient with an open mind. If you are requested to perform a neurological examination of lower limbs, it is pretty obvious that you are dealing with a patient having a neurological condition involving the limbs. What are the childhood neurological conditions that are commonly encountered in exams? Well, different types of cerebral palsy could be given, such as quadriparetic cerebral palsy, diplegic, or even hemiplegic cerebral palsy. It could also be a muscular dystrophy, like Duchenne muscular dystrophy or Becker's muscular dystrophy, or even a myopathy presenting as a floppy infant. Paraplegia due to spinal meningomyelocele is another possibility. And also, a child recovering from Guillain-Barré syndrome is also possible to appear in exams. Right, so you will now witness the neurological examination of lower limbs in a child performed by a pediatric doctor.
Can you examine this 3-year-old child's lower limbs and anything relevant?
Dr. Nimesha, ඔයාගේ බබාව චුට්ටක් බලන්න. ඉතල අපි චුට්ටක් ඇවිදලා බලන්නද? ඇවිදලා පෙන්නන්න පුළුවන්ද? පුතා ඔයා බහලා මම චුට්ටක් අර කියලා වලට ගිහින් එන්න පුළුවන්ද? මෙතෙන් ඉන්න. මෙතෙන් එන්න. පුතේ ආයෙත් මේ පැත්තට එන්න. නෑ අම්මා අතල්ලාව තමයි. ආයෙ ගිහින් එන්න. ඉස්සෙල්ලා වගේ චුට්ටක් බලමු ඈ. අම්මා මම කකුල් දෙක පොඩ්ඩක් බලනවා බබාගේ. කකුල් දෙක කොහේ රිදෙනවා කියලා කියනවාද? කියන්නේ නැහැ නේද? පුතේ වල කකුල් දෙක කොහේ රිදෙනවද? එහෙම නෑ නේද? කකුල් දෙක මම ඔයාලට බලනවා. රිදෙනවා නම් කියන්න ඕනේ. හරිද? ඔය කකුල කොහොමද දෙන්නේ නැහැ නේද? මම චුට්ටක් උස්සනවා. හරිද? ඔයා කකුල පුතේ බුරුල් කරලා තියාගන්න ඉන්න ඕනේ. බුරුල් කරලා තියාගන්න. ඉදලා නම් කියන්න. පුතේ මේ කකුල උස්සන්න පුළුවන්ද? අවශ්‍යමද? චුට්ටක් උස්සන්න. මේක උස්සන්නකෝ.
උඩට උස්සන්න පුතේ.
මේක උස්සන්න චුට්ටක්. අමාරුයිද? කමන්න. මේක කොහේ? ඒක තමයි. Please not cooperate to do the power examination, so I like to proceed for tone reflex examination. මේකෙන් ඔයා කකුලට එක එක තැන් වල තට්ටු දානවා. හරිද? මේ කකුල පුරුල් කරලා තියන්න පුතේ. හද කරන්න එපා. පුරුල් කරලා තියන්න. පුරුල් කරලා තියන්න. ඉදලා නම් කියන්න. දැන් මෙතනින් නමල මේ කුඩින් තියන්න. අමින්න. මේකට නම තියන්න. අමින්න. පිටකින් පුතේ නමල තියන්න. මෙතන බොරෝ කරලා තියන්න පුතේ. මෙතන බොරෝ කරලා තියන්න. මම මේකෙන් පතල චූටි ඉරක් අඳිනවා නේද? පුතේ චුට්ටක් ඉන්න පොඩ්ඩයි අඳින්නේ. ඉන්න චුට්ටක් ඉන්න. හරි. මේකත් බලමු. අත් දෙකක් බලනවා යාගේ. පුතේ නෑ හාස්‍යයෙන් පුතේ අත් දෙකක් බලමු. අත් දෙකක් තට්ටුවක් දාලා බලනවා. අත ගොරෝ කරලා තියන්න. Kiridana. Nah, udah cutak indah kan pulang enggak? Hai. Alhamdulillah. Thank you, Hina. 3 and 6-month-old girl who is lying comfortably on the bed. He seems to be adequately grown, but I want to check her growth parameters and plot in appropriate chart. And in lower limb examination, she is not having any scars or muscle biopsy scars in lower limb, and there is no abnormal movement, and there is clubfoot deformity in the left side ankle, and also there is muscle wasting in the left side calf area. And there is no any other visible abnormalities which I could find during my inspection. In power examination, I couldn't do it properly because Shali is not well cooperated during my examination. And in reflexes, she is having exaggerated reflexes in the left side ankle and knee joints, and reflexes of the right side are normal. And she is not having any clonus, but her Babinski is upside in the left side. And she is having left side circumductive gait, and also during walk she is keeping her left side in flex position, so which is more suggestive of hemiplegic gait. And in her upper limb examination also I could find that she is having increased tone and increased reflexes in the left side upper limb, and right side upper limb examination is normal. And she is having OFC of 48 centimeters, and which is I think appropriate for her age. And she is not having any surgical marks, and there is no PP shunt also. And she is not cyanosed and having normal dual rhythm and having normal pulse rate also. And her abdominal examination, she is not having any palpable bladder or no fecal masses also. So finally she is having left side increased tone and reflexes in left side. So I think she is having left side hemiplegia without any major complications. Most probable cause I think because of the perinatal insult.
I will go through the short case from the beginning now. When you are given a command to examine the lower limbs, it will be one of the following cases. Number 1, cerebral palsy, either diplegic, monoplegic, or even quadriplegic. It could be a muscular dystrophy or a myopathy, a joint swelling, or even a rash on the lower limbs like Henoxian line purpura. So make your observations first. See whether the child looks normal or dysmorphic, the ability to walk, and then start with the gait of the patient as what Dr. Dimesha does here. Can you observe the circumductive gait on the left side with elbow flexion on the left arm? The child will walk again. You must also note that it's not very easy examining children. They won't listen to your commands all the time. So see how difficult it is to get the child walk. If you notice the circumduction, but if you can't notice the elbow flexion, you need to get the child run if possible. Then the elbow flexion will be obvious. Okay, so when she comes back, see whether you can observe the circumduction on the left leg and elbow flexion on the left arm at the elbow joint. Right. So I hope you observed the hemiplegic gait. Now you have to get the child onto the bed and examine from the beginning with your inspection, palpation, power, tone and reflex assessment, and so on. Observe from a distance, see whether there are any walking appliances around, special shoes and things like that. And try to get the rapport of the patient, talk to the child, explain what you are going to do. Inspection. Look at the muscle bulk. Now the muscle bulk on the left side is slightly reduced, so try to observe that on this patient. Leg length discrepancy. You can see that the left leg is slightly shorter than the right leg. Look for any surgical scars of muscle biopsy or even tendon release at the hamstrings or tender Achilles, and also try to note whether there is any foot size difference. If there is a perinatal complication or an antenatal event causing hemiplegia from early onset, there may be a foot size discrepancy, like in this child. I will show you a picture at the end of the presentation to show the difference in the foot sizes. Right. Now she is assessing the tone. Also observe whether there are any contractures or deformities. You need to observe the child's active movements as well. You may ask the child to do some active movements for you. But I think in this short case, this doctor is finding difficulty in getting the child do any active movements. So it's normal in children. You can't go by the correct technique all the time, and you may not be able to elicit everything in a child, but you should be able to work out a clinical judgment with whatever you can do. Right, so she refused to do any active movements. Then see whether there are any contractures, especially at the ankle joint and hamstrings, and then at hip flexor, hip joint. So the commonest contractures in hemiplegia that you can find are ankle joint contracture, which this child has, hamstring contracture, which she doesn't have, and also adductor contractures and hip flexion, which also are not there in this child. So Dr. Nimesha is trying to elicit the reflexes here. See whether you can appreciate the exaggerated reflexes on left knee and ankle. Dorsiflexion at the ankle is difficult because of the fixed contracture at the ankle joint. In the exam, you should demonstrate these contractures, whether you have to show whether the contractures are dynamic or fixed. Now you could observe here, Dr. Nimesha tried to do dorsiflexion and it was limited, which means that there is a fixed contracture. There was no clonus though. Okay, you expect plantar reflexes to be upgoing, but sometimes children withdraw, so you find it difficult to elicit. So try to do if possible. Up to 2 years of age, Babinski response is anyway positive. In this short case, Dr. Nimesha was not able to assess the muscle power, but you can gauge the muscle power by the movements the child does when you are examining. So it's quite obvious this child has grade 5 muscle power because she could walk properly, she could resist the handling by the doctor. So that implies she has good muscle power. Right. Having finished the lower limb neurological examination, then you move on to the upper limbs to elicit whether there is evidence of part of hemiplegia affecting the upper limb as well, right? So you only have to do the tone assessment and reflexes in the upper limbs. This child has increased tone and increased reflexes in the left upper limb. After examining the upper limb, now you have demonstrated all the evidence of hemiplegia in the child. Then you need to spend few minutes on finding out the etiology or the possible cause for the hemiplegia. So what are the common causes that you need to look for? A child with microcephaly may have suffered from an antenatal cerebrovascular accident or perinatal hypoxia caused by hypoxic ischemic encephalopathy, or even things like neonatal meningitis. Apart from that, children with cyanotic heart diseases may have cyanosis and a cardiac murmur, could have had infective endocarditis and cerebral abscess. Now she is looking for evidence of a craniotomy scar and also a ventricular peritoneal shunt to see any evidence of cerebral insult to this child. So those are the examinations that you need to do to elicit a possible underlying etiology. Right. And during your examination, you also could pay attention to, as to what complications this child is suffering from. For an example, you already noticed this child has functional disability because she can't walk properly, but however she is managing to walk, with difficulty with the limp. So that is one of the complications this child has developed because of the hemiplegia, functional disability. And then some children may have learning disabilities as well. So you would like to find out, right? So in your discussion in the short case, you will have to indicate to the examiner that you would like to know about the intellectual development of this child. You didn't observe her talking, right? So you will have to ask from the mother how her speech is like. And also, children with hemiplegia, they have suffered focal brain damage. They may be suffering from focal epilepsy. So you need to discover that as well. And then fixed contractures. So you could elicit that this child has a fixed contracture that indicates this child is not very well managed. She has not undergone adequate physiotherapy so as to maintain good mobility at the ankle joint. So she already has developed some degree of tender Achilles contracture, which will need vigorous physiotherapy to continue, and also in the future she may need tendon release surgery or tendon lengthening surgery. Right. So that is how the discussion goes. You observed how Dr. Nimesha presented the case. So at the end of your presentation of the examination findings, you need to give your impression or the conclusion. Right. And then the examiner will direct you 2 or 3 questions like, what do you think about the etiology? What could have caused this hemiplegia in this child? Right. So then you need to come out with some possible causes. And then the examiner might ask, what complications do you think this child is suffering from due to hemiplegia? Or what other complications may be there in this patient? You may have to talk about learning difficulties, seizures, and difficulties with activities of daily living and so on. And sometimes you may be asked about the investigations that you could do to reveal the underlying problem. You may talk about imaging like contrast enhanced CT scan, which will reveal cerebral atrophy on the contralateral side, and also MRI scan, which will show the ischemic areas and also the volume loss of the brain. So that is how the discussion would go in a short case of lower limb examination. So I would like you to go through the video clip again and also listen to Dr. Nimesha's presentation and improve your skills. And at the same time, I would like to advise you to go through the mini CEX format that is provided you on the examination of lower limbs in the pack of portfolio given to you in the proper appointment of pediatrics. Thank you.